Hi, I'm Dr. Ketan Shah, and if you're considering a colonoscopy, this short video will walk you through exactly what to expect. Many of my patients schedule their colonoscopy directly online before ever meeting me, so I made this video so you can get to know me and feel comfortable with the process ahead of time. I'm a triple board certified gastroenterologist with over 10 years of experience. I've performed thousands of colonoscopies, and preventing colon cancer is one of the most rewarding parts of what I do. My mission is to completely eradicate colon cancer in Orange County, and every colonoscopy helps move us towards that goal. Colon cancer is unfortunately very common. Almost 1 in 20 people will develop colon cancer during their lifetime. It's the second leading cause of cancer-related deaths, and it has recently become the leading cause of cancer death in younger people. But the good news is that colon cancer is one of the most preventable cancers. Almost every colon cancer starts off as a benign but precancerous polyp, and up to 50% of people will develop these polyps. These polyps can be detected and removed before they ever turn into cancer, and the only way to do so is with a colonoscopy. One thing that is becoming increasingly emphasized in colonoscopy is quality. If a polyp is missed during a colonoscopy, it could still develop into cancer before the next colonoscopy is due. Because of this, gastroenterologists track something called the adenoma detection rate, which measures how often precancerous polyps are found. Doctors are expected to detect polyps in at least 25% of our patients. On average, I detect polyps in over 60% of my patients, which places my detection rate among the highest in the country. One reason I'm able to achieve this is that I take my time and examine the colon very carefully. Another reason is that there are newer devices designed to maximize detection of polyps by improving visualization. The most commonly used device of this type is called the endocuff. This device attaches to the end of the camera and has small, flexible arms that gently flatten the folds of the colon, helping reveal areas where polyps are commonly hidden and missed. In randomized clinical trials, the endocuff has been shown to increase polyp detection by up to 50%. I do recommend it, but it's not covered by insurance, so you'll receive a payment link in your email instructions if you would like to opt for this device. It is completely optional. During the procedure, we give patients sedation so they are comfortable and sleepy. So you'll need someone to drive you home, and you will not be able to drive that same day. Then I'll insert a small, flexible camera about the size of my little finger into the rectum and carefully examine the entire colon, which is about 5 feet long, removing any polyps if I find them. The procedure typically takes about 30 minutes. I know this isn't the most glamorous procedure to talk about, but for us, it's something we do every day, and our entire team works hard to make the experience as comfortable and stress-free as possible. As you can imagine, the colon needs to be completely cleaned out so we don't miss anything like cancer or polyps that could be hidden behind any stool. Because of that, the preparation is almost as important as the exam itself. Preparation involves changing your diet for 3 days prior to the procedure and avoiding foods that contain a lot of fiber, such as seeds, nuts, popcorn, fruits, vegetables, grains, lentils, and salads. During the 24 hours prior to the procedure, you will stay on a clear liquid-only diet, including clear juices, broth, jello, soda, and coffee without dairy or creamer. Finally, during the night before and the morning of the procedure, you'll take the preparation we prescribe according to your written instructions. It can come in pill form or liquid form. Colonoscopy is generally a very safe procedure, but like any medical procedure, there are some risks. These include reactions to sedation medicines, small risks of bleeding or infection, pain or discomfort, and very rare complications such as injury to the spleen or a perforation, which is a tear in the colon. Rarely these complications could require emergency surgery, colostomy, or even lead to death, but these situations are extremely uncommon, and the vast majority of patients do extremely well. After your procedure, you'll go home with a copy of your procedure report. Take it easy for the rest of the day, and most patients end up taking a nap. Most people return to their normal activities the following day. I will also email you a high-resolution digital copy of your report with pictures. And if we take biopsies or remove any polyps, I will send you those results along with my recommendations, including when your next colonoscopy should be. Thank you for taking the time to watch this video. I hope this gives you a sense of how much I care about preventing colon cancer and how seriously I take the quality of every colonoscopy I perform. When you're ready, you can schedule your colonoscopy directly online at bookmycolo.com. No referral required. I look forward to taking great care of you.